Okay, so hi everyone. This is our pre-application webinar for our community grants program for 2024 to 2025 under the Urban Indian Health Institute. We are so excited that you all were able to join us today. To go through a brief agenda, we'll do staff introductions, a community grant program overview, describe our SAGE funding opportunity, go through application logistics, discuss some of the critical dates and technical assistance opportunity, and then follow up with any questions and answer session at the end. So welcome again. We are so grateful that you're here with us to go through this funding opportunity. Kuha'ahat Hatebosa, Kumbak Iha Kaylee Edwards. Hello, everyone. My name is Kaylee. I'm Caddo, Kiowa, and Comanche from Oklahoma City. I'm the Senior Program Manager for the Chronic Disease Prevention Team, which oversees our community grants program. So I'll be the main point of contact for the grant application and logistics, and then as we get into the program. And then our leadership is Lenny Spaker, who is Turtle Mountain Band of Chippewa, and she is our public health officer. So she'll be definitely overseeing all of our grant programming as we go through the year together. We also have an evaluation team because the evaluation component is a pretty big component of our community grants program, and they provide technical assistance and resources and other supports. So we have Bonita and Cheyenne who will be working with our team to help you all. So the SAGE Community Grants Program is funded through the Centers for Disease Control, Good Health and Wellness in Indian Country. The purpose of our SAGE Community Grants Program is to support the health in the urban Indian, American Indian, Alaska Native populations by funding grant programs to combat chronic disease and build evidence for Indigenous approaches to education, prevention, and management. Our main objective for this community grants program is to strengthen public health among urban American Indian Alaska Native organizations by funding culturally rigorous programs and interventions that reclaim health and wellness. So the Urban Indian Health Institute is continuing to collaborate with urban American Indian and Alaska Native serving organizations to reclaim values of data, evaluation, and research to strengthen public health capacity, address health disparities, and promote health resilience in urban Indian communities. Our SAGE grant period is September 30th to 2024 to September 29th, 2025. In this upcoming grant cycle, these funds will prioritize culturally rigorous community approaches to address commercial tobacco use, diabetes, including prediabetes, high blood pressure, obesity, including physical activity and nutrition, oral disease. We will approximately accept 10 SAGE grantees to be selected for up to awards of $61,670. This year, we're really excited to modernize our application, which will be submitted online as a form, Microsoft Forms. We can go through the application components here in a little bit, and all of our application materials are available on our Sage Grant website with the application link and then the other application components. I did want to make a note that our SAGE grant application says September 30th, 2024, and we just now did the call for applications a couple weeks ago. All of the funding that are for current programs, you can backdate the different components for your budgets, and so that contracts or different things like that can cover the costs and expenses for your programming for that grant period. And we can go further into that during the question and answer session. So this is a really important note for who is eligible to apply. To be eligible for this funding and the request for applications, your organization must be an Urban Indian Organization, UIO, or a Title V program as defined under the Indian Health Service, a member of the National Urban Indian Family Coalition, or a not-for-profit urban Indian organization whose leadership and board are made up of a majority of urban Indians and whose mission is to provide public health services to urban Indians. And these cases may be eligible on a case-by-case basis. So we do have some funding restrictions since this is a federal grant. And some of these restrictions are that recipients may not use these funds for research, for clinical care, nor for the purchase of furniture, equipment, or other clinic and patient supplies. Recipients may use the funds for reasonable project purposes, including personnel, travel supplies and services, and salaries if the requested are restricted to project activities. So our application components consist of the following items. So we have an application form that I described a little bit earlier as an online Microsoft form. So as you go through, there will be a lot of questions and eligibility requirements that you can go through and fill out. There's a work plan and a budget worksheet and justification. On our website, we also have a copy of the application form in a paper version. So if you wanted to go and look at the application before filling out the Microsoft forms, we definitely recommend that. And if you have issues with the online version, you can also submit a paper version, but we do prefer the online Microsoft form application to be submitted. And the work plan and budget worksheet and justification both need to be emailed to myself and our program team at cdp@uihi.org, which I'll give a little bit more information on a little bit later in this presentation. And again, all of our application materials are located on our website at uihi.org/sage-grants. And so again, for the application submission to be complete for review, you will submit a completed work plan and budget worksheet and justification to the cdp@uihi.org with the subject line 2024-2025 SAGE RFA, and you'll insert your agency name. This will help us locate your application and streamline the process for quick review. Applicants with limited online access may request an application form as a Word document. Only one application form is required. So if you submit your form through Microsoft Forms, that is the only time that you have to submit an application. You do not need to submit the Microsoft form with a different application. Since we do require the budget justification, we do have this example that we can share with you all for what that could look like. And so, like we said, allowable costs include salary, fringe, maybe your programming has consultant costs where you bring people in to do different activities with your community. We definitely can cover the cost of supplies. And so you'll go through and just write the justification for why you're requesting these funds and how much you're requesting. And so for our selection process, we do have a three-phase holistic approach where we go through a pre-screening for eligibility. We do an in-depth application review, and this will be both qualitative and quantitative. And so we also have time where we sit down as a review committee to do consensus-based decision making. After grantees are selected, the UIHI team will notify CDC staff of our selections. We must receive written approval before we can notify about our selections. So please be patient with us during this process, and we will aim to announce the 2024 to 2025 SAGE grantees by February 17th, 2025. So a critical date and technical assistance is that our applications are due by Friday, January 31st, 2025 by 11:59 p.m. and that is Pacific time. All of the application materials must be emailed to that cdp@uihi.org email. And if you need any type of assistance with your application or questions regarding your application, please feel free to email myself and our program team at that same cdp@uihi.org email. And we will be very responsive as we know that this is a pretty quick turnaround. You have a little over a month to complete your application. And so for the RFA and project award timeline, we released the application December 12th. Today we're doing the pre-application webinar. Like I said In the last slide, our application closes on January 31st, and then we have about a 2-week window to do the award notifications. And so as your organization is filling out those Microsoft forms online, our team is able to go through and start that review process as they come in. And so then our new grantee orientation will be March 3rd, 2025. And we really look forward to getting started and helping fund these amazing programs for health promotion and chronic disease prevention. So now I will open it up to any questions. Since we are recording, please unmute or use the raise your hand function to ask your question. Whenever you ask the question, please introduce yourself with your name, tribal affiliation if applicable, and your organization. Ask your question, and then please remember that this session is being recorded and it will be posted on UIHI's website. If we are unable to answer specific questions about proposals or eligibility, we will definitely respond back to your question through our email, or we can set up another time to speak separately with you. So with that, that is the information that I have for our community grants program, and we will leave it open for questions. And feel free to use the chat function if you don't want to come off of mute. Otherwise, we have our email listed and we will definitely respond back to all of your questions specific to your program as they come in.
Hey, Kaylee, I have a message coming in from Letitia. What are the evaluation or reporting requirements if awarded?
Yeah, so if awarded, we have our evaluation components include a change story, which is maybe a quote from whatever type of programming that you're doing within your community. We also ask for photo narratives where you can tell the story of the program and the impact. We also work with our evaluation team and your program to help you if you don't already have culturally attuned surveys to see and evaluate the progress or the progress of your programs and whatever that means for your community and to meet the needs of your community. So we really do try to keep it very low barrier, and we try to be accessible for you. And so there aren't very strict requirements, but we do have monthly technical assistance calls. We will have monthly community of practices in which all of the grantees will really lead those sessions to see what type of programming you're going through, what are the strengths of your program, what impacts you're seeing in your community. Um, and so those are some of the items.
All right, I have another question coming in from Native Core from Whitney. What is the initiative or goal of the grant? Um, is there an in general, sorry, one second. Is there an in general of our program and is there a main initiative? I'm sorry, I'm trying to figure out that question as well, but what is the main initiative of our grants program?
Yeah, the main initiative of our grants program is to support health promotion and chronic disease prevention in the areas of tobacco cessation, diabetes, heart disease, oral health. And so the goal of our program is to provide funding for any of your programs involved in the community in those specific areas. Lena, you're muted.
I have a question from Michael coming in,
Okay.
just to reiterate what you had already explained about the grant period, how it lists the year, but we actually only have 7 months and how that would work.
Yes. So for this year, since there was a little bit of a delay between notifications between the funders, you're able to backdate um, some of your program expenses that relate to your program application. And we can definitely have another conversation or a follow-up email outlining what exactly that could look like for specific examples.
And this question comes from Taryn. Can this funding be used to purchase food or produce?
We're able to assist with funding for food or produce if it directly relates to your program. So let's say your program is to address diabetes prevention, and so the way that you're doing that type of programming is through traditional foods. And so let's say you have a workshop where you're teaching them how to make some type of traditional recipe. In that case, you're able to cover food costs. But if you're just paying for food during programming, we'll definitely have to have a further conversation about if that is allowable or not. But anything related to um, programming, it's an allowable cost for food.
And I have a follow-up from Michael regarding the funding period. He asks, will there be a no-cost extension?
I will follow up with that question. I'll have to check with leadership on that answer. Thank you all for all of your intentional questions.
I have another question from Taryn. She asks, what are we able to work with multiple objectives or do we have to focus on one?
You can definitely focus on multiple objectives. And so something that we're really excited about in our updated Microsoft Form application is that you can actually click one or all of the objectives that meet the needs of your unique program. So we definitely support whatever program, and we're really excited to read through the applications to see what types of activities you have planned, but you can definitely work with multiple objectives under this. I see a question in the chat that says, great, will we receive the slides or the link to apply after this briefing? Yes, we will post these slides as a PDF on our website along with this webinar. And all of the application links are on our website, and Lena will post our website in the chat. Yeah, of course. Was there any other questions or final thoughts?
Haley, I have another question coming in. It asks, is it okay if we propose the continuation of an existing program that would meet the objectives, or does it have to be a new program?
You can definitely propose a continuation of an existing program. We're really excited to read through the amazing work that you're already doing in community. But if you would like to use these funds as a funding opportunity for a new program, that's okay also. We're really looking for different innovative solutions directed by you for your community to really just try to support with this chronic disease prevention in the areas that we described a little earlier. So whether that's a new or existing program, we are happy to support in through the SAGE Community Grants Program. So that's totally allowable.
I have a question from Johnny, and he asked, is tobacco policy advocacy covered under commercial tobacco use prevention and cessation promotion?
Johnny, I can definitely send a follow-up to your question. I believe that that should be included, but we can definitely have a further conversation. We are really looking for programs that include this because I don't want to say there isn't a lot of work, but a lot of the applications that we get cover other areas. And so we are excited to read about different areas of advocacy like tobacco cessation also. So I'll definitely do a follow-up and get back to you after this session.
Taryn asks, does your tobacco objective allow us to work on sacred tobacco promotion?
Yes. If there are any other specific questions as far as specific programming questions or activities, you can definitely email our CDP at uihi.org and we are happy to answer all of your questions related to specific programming. I think we're going to give this a few more minutes if there are any lingering questions, and we're happy to answer. All right, thank you so much for your time. We really appreciate you joining in and taking the time to listen to our webinar. We hope you have great holidays that are coming up, and we look forward to your application. And again, we are here to assist with any of your other questions for the application and review process. So thank you so much and have a great one.